Welcome to Crazy Nurse RN Hub, where learning becomes a tradition. Come, join me as we explore the multifaceted world of nursing. Hi there, student nurses. My name is Criselmer Ducanes, clinical instructor teaching fundamentals of nursing practice. Today, we'll be talking about evidence-based practice and research in nursing. Current standards of professional performance for nurses include using evidence and research findings in practice. At the minimum, all nurses are expected to use evidence and research to determine proper nursing actions, to engage in research activities as appropriate for their abilities, and to share knowledge with other nurses. All nurses need a basic understanding of the research process and its relationship to evidence-based practice. Now let's define evidence-based practice. It is also known as evidence-based nursing. It occurs when the nurse can integrate best current evidence with clinical expertise and family or patient preferences and values for the delivery of optimal healthcare. Thus, as evidence changes, so must practice. We have here 6 steps in evidence-based practice. First is cultivate a spirit of inquiry. Nurses need to be curious and willing to investigate how various practices compare and which might be best for a specific client. Next is ask clinical questions. For consistency and efficiency, nurses should state the question in a standard format, such as PCOT. So we will discuss PCOT in the following slides. Next, we also have search for the best evidence. In the previous step, key terms are identified that facilitate identifying relevant evidence in the literature. Next, we have critically appraised the evidence. Several toolkits or schema are available to assist the nurse in determining the most valid, reliable, and applicable evidence. In some cases, relevant studies may already have been synthesized. Next is integrate the evidence with clinical expertise and client or family preferences and values. Evidence must not be automatically applied to the care of individual clients. Each nurse must determine how the evidence fits with the clinical condition of the client, available resources, institutional policies, and the client's wishes. Only then can an appropriate intervention be established. And lastly, implement and evaluate the outcomes of the intervention. The nurse gathers all relevant data that may indicate whether or not the intervention was successful. If the outcomes varied from those reported in the evidence, this evaluation can help determine the reasons for the variable responses and will contribute to improving the evidence available for future situations. Now let's discuss the components of evidence-based practice. So they are clinical expertise, best evidence, and of course, patient values and preferences. So again, these are the components of your evidence-based practice. Now let's discuss research. It entails using formal and systematic processes to address problems and answer questions. The disciplined thinking and the careful planning and execution that characterize research means that the resulting findings should be accurate, dependable, and free from bias. Now let's discuss nursing research. Using research findings to guide decisions about the client care. As early as 1854, Florence Nightingale demonstrated how research findings could be used to improve nursing care. So we have here different approaches to nursing research. Nurse researchers use 2 major approaches in investigating clients' responses to health alterations and nursing interventions. These approaches, quantitative and qualitative research, originate from different philosophical perspectives and generate different types of data. Both approaches make valuable contributions to evidence-based practice. Now let's discuss the quantitative research. It entails the systematic collection, statistical analysis, and interpretation of numerical data. Quantitative research is characterized by planned and fixed study processes, careful attention to extraneous variables or contaminating factors in the study environment, and an objective and distance relationship between the researcher and what is being studied. Reports of quantitative research are characterized by statistical information, tables, graphs, which can make them intimidating to read. Now let's discuss extraneous variables. So these are any variables that could influence the results of the study other than the specific variables being studied for their influence. The quantitative approach to research is linked to philosophical perspective of logical positivism, which maintains the truth is absolute and can be discovered by careful measurement. This perspective proposes that phenomena are best understood by examining their component parts. This is referred to as a reductionistic perspective. Positivism is the philosophical perspective of natural sciences such as biology and chemistry. It focuses on the who, what, where, when, why, and how questions. On the other hand, qualitative research is the systematic collection and thematic analysis of narrative data. In other words, the research collects and analyzes words rather than numbers. The qualitative approach to research is rooted in the philosophical perspective of naturalism, sometimes referred to as constructivism, which maintains the reality is relative or contextual and constructed by individuals who are experiencing a phenomenon. This philosophical perspective is reflected in the human sciences such as anthropology, sociology, and existential psychology. Qualitative research has a holistic perspective and results in a report that may read like a story. Nurse researchers tend to use one of the three distinct qualitative traditions. We have phenomenology. It focuses on the lived experiences. We also have your ethnography. It focuses on cultural patterns of thoughts and behaviors. And lastly, we have the grounded theory. It focuses on social processes. Additional qualitative types include historical and case study research. Next, we have the research process. It is a process in which decisions are made that results in a detailed plan or proposal for a study, as well as the actual implementation of the plan. Nurses who are reading research reports to inform their practice need a basic knowledge or understanding of the research process in order to judge the credibility of a study's findings and their usefulness for evidence-based practice. Although the research process unfolds somewhat different from quantitative and qualitative studies, the same general steps are involved. First, we have your formulating the research problem and purpose. Next is determining study methods. Third, collecting research data. Fourth is analyzing research data. Fifth is communicating research findings. And lastly, using research findings in practice. First, let's discuss formulating the research problem and purpose. The researcher's first task is to narrow a broad area of interest into a more specific problem that indicates the issue of concern behind the study. Ideas for research problems may arise from recurrent problems encountered in practice, questions that are difficult to resolve because of contradictions in the literature, or areas in which minimal or no research has been done. One strategy for stating the problem you wish to explore is to use the PICO format. P stands for patient, population, or problem of interest. I stands for intervention or therapy to consider for the subject of interest. And C stands for comparison of interventions such as no treatment. O stands for outcome of the intervention. In some cases, additional components are added to make PICO into PICOD, that's the inclusion of letter D. By adding the study design, we also have your PICOS by adding setting, or PICOC by adding the context, and lastly PICOT by adding time frame. Several other frameworks are available and are not limited to asking nursing questions. So this is how you formulate your research problem. So make sure that these components are visible or are found on your research problem. Reviewing the literature can also help the researcher identify strategies that have been used successfully or even unsuccessfully in the past to investigate the problem and to measure the variables of interest. First is the dependent variable. It is a behavior, characteristic, or outcome that the researcher wishes to explain or predict. Next is independent variable. It is the presumed cause of or influence on the dependent variable. In some studies, the researcher may develop a hypothesis or a predictive statement about the relationship between two or more variables. Next, let's proceed to the determining study methods, which is the second step of your research process. The study's methodology can be thought of as its logistic or mechanics. The methodological elements of the research process deal with how the study is organized, who or what will be the sources of the information for the study, and the data collection details, such as what data will be collected, how data will be collected, and the timing of data collection. The first methodological decision made by a researcher is whether the study will use a quantitative or qualitative research approach. This decision has implications for subsequent methodological decisions about research design, sampling, and data collection, as well as data analysis. First, we have your research design. It refers to the overall structure or blueprint or general layout of a study. The research design indicates how many times data will be collected in a study, the timing of data collection relative to other study events, the types of relationships between variables that are being examined, and the number of groups being compared in the study, and how extraneous variables will be controlled so that the study findings are more reliable and accurate. Now let's have the sample. Another key methodological decision is determining who or what will provide the data for the study. The sample or sources of information for a study may be humans, events, behaviors, documents, or biologic specimens. Samples are carefully selected so that they are accurate as a representation as possible of the target population. The target population, or the universe of elements to which the researcher wishes to be able to apply the study findings. The sample is carefully chosen segment of the target population. Now let's proceed to pilot study. One quality control strategy in research. A pilot study is a dress rehearsal before the actual study begins. Pilot studies are helpful for detecting problems such as instructions or questionnaire items that can be misunderstood, for providing a chance to correct these problems before formal data collection procedures get underway. Now let's proceed to collecting research data. During the actual data collection phase of a research study, all of the methodological decisions that have been made are implemented. Researchers expend great efforts to ensure that the data collection occurs in a consistent manner throughout the course of the study. Detailed data collection protocols or instructions and careful training of research assistants are strategies that can be used to ensure the consistency and integrity of data collection procedures. Various procedures are available for establishing the reliability and validity of research data. Reliability means the consistency of measures. When we say validity, it refers to the completeness and conceptual accuracy of measures. The way in which reliability and validity are established depends on the data collection procedure being used and the nature of the data being collected. Conducting a pilot test allows a researcher to do a preliminary estimate of reliability and validity. Next, let's proceed to analyzing research data. During the data analysis stage of the research process, the collected data are organized and analyzed to answer the research questions or test the study's hypothesis. If a study has used quantitative approach, data analysis involves the application of a variety of statistical procedures. Example is your descriptive statistics. These are procedures that organize and summarize large volumes of data, including measures of central tendency and measures of variability. For the measures of central tendency, it provides a single numerical value that denotes the average value of a variable. Now let's discuss the measures of variability. It describes how values for a variable are dispersed or spread out. Next is your inferential statistics. The use of inferential statistics allows researchers to test hypotheses about relationships between variables or differences between groups. Inferential statistics are particularly useful when a researcher wants to establish the effectiveness of an intervention. After inferential statistics have been computed, the results are inspected for statistical significance. If results are statistically significant, it means that they are not likely to have occurred only by chance. The notion of statistical significance is linked to probability. Next, let's proceed to content analysis. If a research study uses a qualitative approach, data analysis involves searching for themes and patterns. This procedure is sometimes referred to as content analysis because the content of the narrative materials is being analyzed. Qualitative researchers may synthesize their findings to develop a theory or conceptual framework of the phenomenon being studied. Now let's proceed to communicating the research findings. Research findings must be made public if they are to become accessible and used to guide practice decision. Research findings can be communicated through publication in journals or at conferences. Even small-scale research projects that are carried out in a clinical setting should be communicated. Newsletter articles and research posters are ideally suited for this purpose. Now let's have the last step of the research process, using research findings in practice. As described earlier, evidence-based practice entails using research findings and other sources of evidence to guide decisions about client care. Before a study's findings are used to guide practice, they should undergo 3 types of evaluation. We have your scientific evaluation, comparative analysis, and cost-benefit analysis. When we say scientific evaluation, it is a thorough critique of a study for its conceptual and methodological integrity. This means scrutinizing how the study was conceptualized, designed, and conducted in order to make a judgment about the overall quality of its findings. Next is comparative analysis. It involves assessing study findings for their implementation potential. There are 3 factors to be considered. First is how the study findings compare to findings from other studies about the problem. Next is how the study's findings will transfer from the research conditions to the clinical practice conditions in which they will be used. And lastly, practical or feasibility considerations that need to be addressed when applying the findings in practice. The closer the fit between the characteristics of the setting and sample of the study and the conditions and clients with which the findings will be used, the more likely it is that the desired outcomes will be achieved. Lastly, we have your cost-benefit analysis. It involves consideration of the potential risks and benefits of both implementing a change based on the study's findings and not implementing a change. Both immediate and delayed potential costs and benefits to clients, nursing staff, and the organization as a whole should be considered. With the evaluation of an evidence-based practice innovation, the research process begins again. Now let's proceed to research-related roles and responsibilities for nurses. In today's evidence-based practice environment, all nurses, regardless of their educational preparation, need to be able to assume two research-related roles, that of research consumer and research team member. For research consumer, being a research consumer means routinely searching and reading the current research literature in order to stay current with new insights in client experiences and nursing and medical interventions. There are two skills that are fundamental to this role. First is locating relevant literature and critiquing research reports. In addition to being well-informed research consumers in today's evidence-based practice environment, nurses need to be able to function as a member of a research team. This role is particularly important in hospitals that are seeking or wishing to maintain magnet recognition status. Nurses in hospitals with this designation are expected to be involved in research and evidence-based practice activities on an ongoing basis. One of the major responsibilities as a research team member is to protect the rights of study participants, such as the right not to be harmed. The risk of harm through a research subject is exposure to the possibility of injury going beyond everyday situations. The risk can be immediate or delayed and can be physical, emotional, legal, financial, or social in nature. Next is right to full disclosure. Even though it may be possible to collect research data about a client as a part of everyday care without the client's particular knowledge or consent, to do so is considered unethical. Full disclosure, the act of making clear the client's role in a research situation, is a basic right. Next is right to self-determination. Many clients feel pressured to participate in studies. They believe that they must please the physicians and nurses who are responsible for their treatment and care. The right to self-determination means that participants should feel free from constraints, coercion, or any undue influence to participate in a study. Lastly, we have the right to privacy. Privacy enables a client to participate without worrying about later embarrassment. The anonymity of a study participant must be ensured even if the investigator cannot link a specific person to the information reported. And this leads us to the term confidentiality, which means that any information a participant relates will not be made public or available to others without the participant's consent. So I believe this is the end of our discussion on the evidence-based practice and research in nursing. Thank you so much for listening.